Welcome to Coffee with Kyle number 9. I'm Kyle Ridgway. Good morning. Today I wanted to talk briefly about whether or not research lags behind clinical practice or clinical practice lags behind research. Now, the research would suggest that research findings take anywhere from 10 to 17 years to permeate significantly into clinical practice, to where the majority of practitioners at any profession are utilizing quote-unquote the best evidence or knowledge from research findings, which is a well-cited statistic and something that people talk about quite frequently. Something that I have heard, I wouldn't say often, but something that I've heard before is clinicians say that research lags behind the innovations in clinical practice, or that research lags behind the success of clinical practice, which I find interesting. And so the question then becomes, which position is true or which position is more accurate? And I think, again, this is a problem of communication, of talking about two different things. So if we go back to what clinical research even is trying to do, oftentimes it's trying to elucidate mechanisms of treatment effect or find what is effective or efficacious. So many times that means studying a single intervention or a package of interventions in isolation with a lot of control in order to best conclude whether or not those interventions have an effect on some certain outcomes or physiologic variables or other things that we can measure clinically. Unfortunately, that's not how clinical practice works. So what I would say is that there's probably a kernel of truth in each position. The research citing that it takes 10 to 17 years for research knowledge to kind of permeate into clinical practice is probably absolutely correct. And I would say anyone who's very well involved in research or knows a segment of the research literature very deeply will just notice this observationally. But we even have data on this in the reverse scenario, which is de-implementation of things that have been shown not to work, which is probably a different topic and probably a little bit more complicated than implementation itself. So then what about the position that research, or rather clinical practice, outpaces research? I think there is a kernel of truth in this, but again, I think we're talking about something different. And what we're talking about, and I've spoken about this before briefly, is as clinicians or as a clinician, oftentimes we're looking for that one article, that one study that guides our clinical practice. And as I've stated previously, that's not a hope that's realistic. There's never going to be a study that can tell you exactly what to do in clinical practice, because it will be too loosely controlled to draw any significant conclusions from. Because of this, where is the kernel of truth in the position that clinical care outpaces research, or that research lags behind clinical practice? Well, I think it's in this case, or in this kind of specific little nugget. And that is that if you take the highest performing expert clinicians who know the research really, really well, we can look at these people as not just knowledge translators, but knowledge aggregators. So these people have a very deep knowledge of the diagnoses and the populations that they're working with. And they also have a very deep knowledge of the research base for how to diagnose, treat, risk stratify, do primary, secondary, tertiary prevention in different populations. And so therefore, they may actually perform better than research studies because they have an aggregate knowledge and an aggregate treatment approach that studies really can't replicate. So I think there is a nugget to truth in that. The problem is if everyone is saying this, and this has been shown in the psychological literature, is most likely clinical practice performance, knowledge, whatever we want to look at, is probably a bell curve. Now, if we poll people, no one rates themselves, well, some people do, but the majority of people do not rate themselves as average or below average. Most people rate themselves as above average, even though we know statistically most people on a bell curve are not above average. So there is probably some truth to this claim, but it's probably not as broad or profound as some clinicians would like to think. Yes, of course, the above average clinicians, the best clinicians, the 1 and 2 standard deviations from the mean clinicians are likely outperforming clinical research, but for two reasons. A, they have a deep knowledge of the clinical research, so they're not ahead of the research per se, but they are aggregating and applying it in such a way that they're maximally effective or have the maximal impact. The flip side is that the way research works is to tightly control things to answer often singular questions. Therefore, in order to have the best clinical outcomes, you need to aggregate the information from all these singular questions to help understand what you are treating. So, which lags behind which, research or clinical practice? Well, depending on the lens that you analyze it from, depending on whether you're talking about accuracy and answering single questions and imparting control to get down to very, very precise conclusions versus getting the best outcomes in any moment for a singular patient or a group of patients, I think it may be a coin toss. But again, it comes down to precision in language, defining and narrowing the scope of the problem we're trying to assess, and really setting the conversation up so that we can talk about this in a more accurate way. So that's what I'll leave you with today. Have a good day. It was good to see you.